Thank you, and I have 8 minutes, and I'm sharing with some colleagues as well. Lascan Corla, this is the last opportunity we have to be reassured that the Government has a handle on COVID before the Dáil recess. There is a lot of talk from Government about personal responsibility, and yes, that is part of it. But I honestly believe that the vast majority of people are already doing their best to keep themselves and their families safe. We must act with our healthcare workers in mind and the burden that this pandemic is putting on them. We can reduce our social contacts, we can make sure to mask up and test regularly, but there are limits. The role of government and the obligation on government is much larger. That starts with getting the communication right. That means an end to mixed messaging and contradictions, to ministers flying kites or speculating in the media, and senior politicians in government blaming others when they don't get things right. Over the last few months, the government has failed to make the right call time and again in so many areas. The government made the wrong call on antigen tests from the beginning. They dismissed them and the role they could have played much earlier in keeping people safe. The minister recently refused to subsidise them to increase usage and accessibility, to supplement PCR testing where appropriate with all of the necessary caveats. That is despite the very clear advice from the COVID-19 rapid testing group that was established in April, which was chaired by the government's chief scientific advisor, Professor Mark Ferguson. Rapid tests will be an incredibly important screening tool this winter as families gather for Christmas, and it will be a financial burden on far too many who are already struggling with the rampant cost of living. Your government, Minister, has failed on ventilation and making schools as safe as possible. And despite the very clear advice from the expert group on ventilation, which reported back in March, this government failed to use the summer to protect classrooms. Your government denied for months that schools were a site of transmission. That does not mean that they can't be relatively safe, but the refusal of government to invest in proper systems to control the spread of COVID-19 in schools has made them far riskier than they should have been. You have a window now to right that wrong when schools close for Christmas. When they reopen, every poorly ventilated classroom must be fitted with CO2 monitoring systems and HEPA or appropriate air filtration systems. There is a very cold January ahead, as we know. The government must do everything it can to make schools safer and do right by our children before they reopen. You also need, Minister, to step up the booster campaign. It is unforgivable that government took its foot off the pedal after the summer. The vaccination workforce dropped by a third, and that has delayed the booster campaign for weeks, if not months. You failed to ensure that flexible arrangements were in place to rapidly ramp up the workforce and vaccination capacity. You have not made full use of the pharmacies and pharmacists around the country who have been eager to administer as many vaccines as they can. I think the government have failed in many ways in relation to booster vaccines, despite the mountain of evidence that would be needed, and this has set us backwards. There has been incredible problems with the booster campaign to date, especially with the booking systems. Governments have blamed the slow pace on no-shows, when in reality many of these were people who were already vaccinated or were issued multiple appointments. Government must acknowledge when it gets it wrong, rather than blame people who have already done so much. Alongside boosters for the immunocompromised, the most important task over the next 2 months is vaccination for under 12s. There are many parents with concerns, and they must be addressed and reassured. Parents must have access to any necessary information to ensure a high uptake of the vaccine among this cohort. And the government must do more to reach people who are unvaccinated as best it can. The vaccines are safe and effective. We must make sure that people know this and they have the opportunity to get them. A high uptake across the entire population is essential to controlling the spread and consequences of COVID-19 for all of our people. Our hospitals are in the depths of a very difficult winter, as we all know. At the start of this week, there were 534 patients on trolleys, tucked into ward corners and corridors. Over the course of last week, there were more than 325 patients on trolleys in Limerick, 281 in Letterkenny, and five other hospitals with more than 100 patients on trolleys. That is a very unsafe environment in normal times, never mind a pandemic, for patients and for staff. It illustrates the failures of this government and previous ones, which have left our hospitals vulnerable and left this state in a uniquely exposed position throughout this pandemic. It makes us all the more deeply concerned about this Omicron variant. While it has been reported as potentially less severe, that is little comfort if it is more transmissible and with our hospitals already at capacity. As of yesterday evening, there were only 83 open and available general beds in hospitals. 9 hospitals, including Waterford, St Vincent's, Sligo and Mayo, had none. Only 3 had more than 5. And incredibly, in the budget just gone, not one single additional inpatient bed was provided for or budgeted for over and above what was already in place. Our ICUs are full. There are no available beds for children and only 7 available beds for adults, just around 4 counties. So we know we have real problems in capacity in healthcare, and the government have simply failed to put that capacity in. This is only going to get more difficult for our frontline healthcare workers over the next month. They are already well behind burnout and exhaustion, yet they soldier on. And we do owe them a debt of gratitude, but I fear that will not be repaid anytime soon. They deserve breaks, their annual leave, and to work normal hours for fair pay. They also, by the way, deserve the recognition payment and bonus payment that was promised. We heard an awful lot of talk from government ministers and from the Taoiseach, the Taoiseach and the leader of the Green Party before the budget in relation to a recognition payment for those on the front line. The budget came and went, nothing happened. After the budget, nothing has happened. This is the last sitting of the Dáil before the Christmas break, and yet the government have done absolutely nothing to recognise that hard work by those on the front line in healthcare, and they will be the very same people that will have to do Trojan work over the next number of weeks and months. And shame on the government for not resolving that issue when it should have.